My name is Mary Dwight, and I thank you for all of you joining the live stream as well. I run the Foundation's policy and Compass programs. I am joined by a wonderful panel who's going to particularly focus on Compass. Ozzy Cater, who is a great leader in the Compass department, and also Kat Porco, a CF mom, and Laurie Yoder, a clinical social worker from Northwestern University CF Care Center. So we're delighted to walk you through a little bit of the nuts and bolts of the landscape around coverage and access for cystic fibrosis therapies. That's me. We will be taking questions. Oh, can I grab that?
Oh, yes.
Thank you. We will be taking questions just like we have been throughout the VLC conference. I guess that's redundant. Volunteer Leadership Conference. Here is the information that you need to submit your questions once we finish the presentation. We would love to hear your questions, so chime on in. Now I have the thing. I should actually use this and not reach over. Okay, grounding our work around this foundation's work around access to high-quality cystic fibrosis therapies is our mission, the foundation's mission to find a cure and make sure that everybody has access to the care and treatments that are required to help people with cystic fibrosis live rich, full lives. And to do that, the foundation is a tenacious advocate for people with cystic fibrosis. We know how complicated and complex the healthcare landscape is and how darn right frustrating it can be to navigate insurance in cystic fibrosis. So our mission here when it comes to coverage and access is to really do whatever we can to help make sure that people with cystic fibrosis have access to that high quality specialized care that you get through an accredited cystic fibrosis care center and the treatments that they prescribe. So I really think about our ways of tackling coverage and access as two-pronged. One, we think about it systemically, and that's really where the foundation's policy work comes in. Sometimes that policy is legislative. We talked this morning in the plenary session a lot about the debate over healthcare reform. That's certainly systemic. How are we covering healthcare in America? What is required to compromise goods insurance for anybody, and then certainly through our lens for somebody with cystic fibrosis? And when we're thinking about it in that way, who we're engaging with are policymakers like your elected officials, the White House. We also engage with regulators. At the national level, that means something like the CMS, the Centers for Medicare and Medicaid's the largest payer in the country, who oversees how Medicaid and Medicare operate and what they pay for. So the foundation engages quite frequently with that large federal agency, as well as in the states. We engage quite frequently with just about every state Medicaid office. And we also engage with state legislators as they do make decisions around how each individual Medicaid should function. We also spend a lot of time at the policy level, and I'll talk about this in a little more detail later, engaging with individual private payers, entities like Blue Cross Blue Shield, Cigna, United Healthcare, as we look at how they're covering cystic fibrosis treatments and how we can make sure that they're covering it appropriately. Then on the other side of our two-pronged model here is Compass, which is a vital resource that we're super proud of, which is one-on-one support and case management for individuals with cystic fibrosis, their families, and often their care center teams, helping to be a partner and a collaborator with you as you navigate individual challenges or have questions about potential resources when it comes to coverage for cystic fibrosis. So again, my job here, because the panel is really going to talk about Compass, my job is to explain a little bit more about the work of the policy department. So our job really is, very simply, to advocate for coverage policies, be they systemic of how we are paying for healthcare in the U.S. or granular to how insurer X is covering hypertonic saline. Our job is to advocate for coverage policies that provide appropriate access to cystic fibrosis care and treatment. and to really educate the people who are making those policies about the complex needs of cystic fibrosis care. What I think about, there are a lot of people who talk about CF, and particularly folks, the manufacturers of cystic fibrosis therapies, are engaging with policymakers as well about their particular treatment. Our job at the Cystic Fibrosis Foundation, again, is to be that tenacious advocate for the whole complex picture of cystic fibrosis, to tell the story of the CF care model, why we think that's the best story in medicine, and why we want a payer to really trust what is prescribed in that network, because it's based on data, because it's based on things like the Cystic Fibrosis Patient Registry, because we have amazing tools like the evidence-based guidelines that really guide the decisions around care in cystic fibrosis. How do we do that? We do that by building relationships with the payers. We have a lot of ongoing relationships and now years-long dialogue with many of the national level payers and a lot, again, of the state Medicaid agencies. We collaborate with stakeholders, and frequently that means the voice of the community. And particularly, I want to give a big shout out to the clinical leaders at the Cystic Fibrosis Care Centers, who are ardent champions for the people that they care for and are wonderful, amazing voices to their peers, because usually the decision makers on a lot of these insurance cases are physicians. So pairing physicians who treat people with cystic fibrosis with their physician counterparts who are making decisions on cystic fibrosis coverage. And really, we also get to brag a little bit and telling the story of what a difference we've made over decades as a community in the gains that we've made in cystic fibrosis, the data-driven aspects of that. Again, I can't really emphasize enough how important the data that this community is based on. Again, that registry is so important. Being able to say, look at what we've done, this is where we still need to go, help us along the way, let's have a dialogue. So that's really a lot of the work that happens there. This slide is a little complicated, so I'll try to keep it simple. There are a lot of ways that we find out about barriers to cystic fibrosis care. A lot of times we hear it from you, the community. You call us, you text us, you call Compass and let us know, or we hear through care teams, gee, this just doesn't seem right. Again, these enzymes just aren't being covered in the way that we need them to be. Can you please help us? And so we get intake of, there's a barrier, there's a problem in a lot of different ways. Once we know that there's a barrier, our job is to assess it. What's the problem here? Is this an individual problem with one particular person's plan? Can we case manage it through Compass? Or is this a systemic issue? And is this a policy of the payer that's just not right, that we really need to go in and try to correct? So once we identify that, then we can come up with a strategy to figure out what we need to do to try to remedy it and make sure that the policy is something that's appropriate and is covering cystic fibrosis the way we know it should be covered. Those outreach efforts look different every time. A lot of times they're very sort of back end. They're not something splashed across the New York Times. It's a letter, it's a phone call, it's a meeting, it's testimony at something as exciting as a drug utilization review committee. But there are a lot of different strategies that we're able to deploy, and I'm really proud to say that a lot of times we're very successful in making changes to make CF care better. These are just a few of the things that we're watching. This list could be very long if we were comprehensive with it. But we're certainly continue to watch, or can be expanded label coverage. What do I mean by that? Or can be just recently dropped down to people below from 6 to 11. And so there are changes being put in place by certain payers about how they're going to cover it. Are there different requirements they're going to put in place for somebody with cystic fibrosis to be able to either get Orkambi initially or stay on it, be reauthorized for the drug? So that's something we're watching closely. And I think the next two bullets kind of go together. The notion of really, fundamentally, this is about, we know care at a cystic fibrosis care center is best. And that's really where people with cystic fibrosis should be getting their care. Does their health care plan pay for that? Is that easiest to navigate? And is the center in network or out? And if it's out of your insurance network, is it something that's easily navigated or exempted? So those are some of the things that we're watching. I showed this slide this morning during the plenary, and I said this slide is busy because we are busy, and that is very true. I will take a minute just to explain this slide a little bit more than I did this morning. But basically, all the different colors that you see here are different ways that we're engaging on issues of cystic fibrosis care coverage in each individual state. You see that we have been active in every single state. This is within not a calendar year, but a year-to-year date. This looks like education of lawmakers. This looks like outreach to regulators. By that I mean typically a Medicaid regulatory committee. This means your clinicians speaking out for you at committee hearings or through letters or through meetings. And also this means awareness initiatives and activation by you all with your legislature. There are a lot of really amazing success stories here where we have been successfully engaged to make changes and improve coverage, and particularly change coverage criteria that was not as great as we'd like it to be in a lot of these places. And I will say this is where advocacy is so important, being able for you to tell your story and make connections and have the decision makers understand what cystic fibrosis is. It makes a real difference, but we have to be everywhere, and we're proud that we're able to be. We have Anne's name on here, not Ozzy. So that's a snapshot of the policy work, and I'm now going to turn it over for you guys to learn a little bit more about the wonderful program that is Compass.
Thanks so much, Mary. I am so pleased to share CF Foundation Compass with all of you. But I do want to ask, first of all, before VLC, how many of you here had heard about CF Foundation Compass?
Oh, that's good.
Oh, my goodness. All right. Well, my job is done. Fantastic. Well, I don't know how many of you here know that for many years the CF Foundation has been offering patient access services to people with CF. However, what we offered in the past was really very limited in scope, and frankly because we didn't have the knowledge and the expertise. But over the last year or so, with the amazing leadership of Mary Dwight and Ann Willis, whose name was on the board, I'm actually sitting in for her, we have taken patient access services to a whole new level. We have expanded the services that we offer beyond just helping with insurance issues and connecting people with financial assistance programs to much, much more. And Mary alluded to that earlier today. And I believe you showed this slide earlier today. I'm just going to go through some of these for the sake of time. But what I do want to share with you is that we renamed the patient access services with a name that I find to be very symbolic of what we do. We call it Compass, and when you think about a compass, you think of it as a symbol of navigation. And also, the word compass is in the word compassion. And I can't tell you how proud I am to be part of a team of incredibly compassionate and dedicated patient advocates, and you saw their pictures earlier. I'm kind of going out of order, but I do want to show them to you again. This team is incredible. They work so hard to help people with CF, their families, and the wonderful care teams every day tackle issues around CF. So let's talk about some of those in greater detail, starting with, and I'm going to go a little out of order, I apologize. So starting with insurance. What does that mean? What can we help with? Well, we can help with a whole spectrum of insurance issues, starting with the insurance basics, helping you understand a new insurance plan that you might have signed up for. What does it cover? What is or is not included in the plan? Is your care center included or excluded? And we can help you figure out a way to get it, get a network exception, for instance. And moving up to more complex issues. Suddenly, the insurance plan that you have drops a particular medication, Palmazine, for instance, or a new drug is introduced, or can be, and it isn't covered. We can help you get proper documentation together with the incredible collaboration of your wonderful care team to get all of the documentation together and submit it, and we will stick it out. How many of you enjoy spending time on the phone with insurance companies? I'm just curious. You're hired.
Wait,
we'll talk after
where's
this.
the door prize?
Yeah, right. But all joking aside, we spend hours on the phone with insurance companies, and we don't mind doing it. We are very persistent, and we know that's time that we could be saving you to spend not having to worry about insurance issues and calling and fighting with the company, the pharmacy, what have you, to get your medications covered, or finding out whether your care center is in network. We can do that for you. And now I'm going to move on to financial resources, and I want to spend a little bit more time on this particular topic. Compass has been collecting a database of different programs for years now that are on the national, state, and local levels, including other nonprofit foundations, manufacturer programs, all that offer some form of financial assistance directly for drugs, medications, and therapies. And a lot of people either don't know about them, or they just don't have the time to research, sign up for all of these programs. So what I would say is call Compass and let us help you connect with these programs. We can help you. We have vetted the programs. You don't have to. So we can help you find the right programs to sign up for. And what's even more important is don't go to just one thinking that one program will solve everything. A lot of these programs have caps, and you can blow through that grant very quickly if you don't take advantage of all of the programs that are out there. And we can help you figure out the order in which you should sign up and take advantage of the programs that are out there, really to help maximize the benefits. And also, we have helped a lot of people get Social Security benefits. So please come to us if you're at that stage where you need to consider that, and we can help you get connected. And moving right along, when you have questions about legal rights, whether it's in the workplace, in the school setting, dealing with insurance issues, many more topics, call us and we can help you get connected to the appropriate legal experts that can help you answer the questions and then address them if you need to. And we have been collecting resources in the legal realm as well. And then there's this whole other bucket of assistance, as we like to call it, and we haven't come up with a more clever name, and that's where I would give a prize to anyone who can help us come up with a catchy name there. But really, this is ... and anything that you need help with, give us a call. We may not know the answer right away, but we will find it for you. And I gave an example in the last session, and I'm going to give it to you just to show that we mean anything and everything. We had a family contact us whose house was sprayed by a skunk. And I don't know how many of you have driven down a road where a skunk has been hit, but it is awful, and it takes weeks to get rid of that smell. If for someone with CF, that can really exacerbate your situation. So they contacted us, pleading for us to find a way to help them get rid of the smell. Well, lo and behold, we connected with a company that did deskunking remediation. I don't know whatever you want to call it, and we were able to get them the help that they needed in that case. And there's a whole list there, dealing with all kinds of living expenses, helping with rent, mortgage, finding programs at the local county level that can help defray some of the everyday living needs for people with CF. Now, I skipped through a slide. I'm not going to go back. I'm just going to discuss it. Who can call us? Who can get help from Compass? Really, anyone who is somehow connected with or linked with CF. It's not just the individual with CF. Their families can call us. Parents, spouses, extended family, care team. Contact us, and we will provide assistance to you. And this assistance is free. It's confidential. We will not discuss your specific case, your name with anybody. When you do have a family member call, we, of course, if it's something that's really specific, we do collect consent to discuss anything. And if we don't have it, of course, we don't. And at this point, I'm going to turn over to our wonderful panel, starting with Laurie, to share your personal experience with Compass.
Hi, everybody. Please excuse my out-of-control allergies. They sound like they're having more fun next door. Maybe we should lighten this up.
A little bit.
Okay, we're going to amp it up a little bit. Okay, so thanks for coming later in the conference. It's nice to see all of you. So I work in Chicago at an adult center with about 100 patients, and I'm part-time as a social worker. So you can imagine there's a lot of need and not always the people power. So Compass has been very helpful to us to refer patients to for all the reasons Ozzy just mentioned. Including, like, an example is I had a patient who needed furniture. She needed a bed. So we called Compass, and they helped us figure out how to get a grant for that. But I'm going to talk about what happened last year because we strategized about a big problem. It's my home state, so I can totally make fun of it, but we are a hot mess right now in Illinois. And we decided to go early on the healthcare exchange falling apart. So it kind of fell apart in 2016 in Illinois. And one of the lead case managers at Compass told me we're in the bottom 3 states. Woohoo! So what that meant is, and his name is Aaron Stocks, by the way, if he's watching. Thank you for telling me that, Aaron. So anyway, we had to come up with a plan because we had a lot of adults buying insurance on the healthcare exchange, and one of the major carriers went bankrupt, and the state of Illinois is like, you're done, and this was halfway through the year. And so those patients needed to get a new plan quickly, but also, guess what? Their deductible started over in September, and all of their copay, everything started over. So they basically had a double whammy in 1 year. It was terrible. Of course, I was feeling desperate as a part-time social worker, like, what am I going to do? And then I was also thinking, this is kind of unfair to Compass. I'm going to be telling people, call Compass, call Compass, call Compass. So I talked to Aaron, and I said, I think we need to collaborate. And so basically, he and I worked together, and he would share the information with other case managers. So when they'd get a call from, I'm a patient at Northwestern in Chicago, and I have this problem, they already knew what was going on. It was wonderful. And so we were able to get everybody covered. It was a very stressful couple of months, but we were able to figure that out in working collaboration. You know, it was fantastic. We also have problems with Medicaid for adults in Illinois. We have very few, they're forced into a managed care plan under Medicaid. And then, of course, some of these plans are not in network with any CF center. So it goes on and on. So I've really appreciated Compass in supporting us and our patients with very complicated coverage issues. And I've found Compass to be really helpful with unique things that come up that might be a one-person situation, like an international patient that's come here for life-saving treatment, and we need to figure out immigration issues or how to help them get coverage, insurance coverage, that kind of thing. So I have found no question is, you know, I'm not told I'm being silly for calling. So I would encourage people to call Compass for any reason you might think of.
Thanks so much, Laurie. Now I'm going to pass the mic over to Kat.
Hi guys, I am from Montana, and so we have a lot of issues with just kind of being in rural Montana, and so our main, it's kind of twofold, my experiences with Compass, but on one hand, it definitely saved us almost $1,200 a month in our insurance premiums, because the plan that the navigator, just kind of just a marketplace navigator, put us into was almost $1,400 a month in order to cover everything that my daughter needs every month, and that took numerous trips to our nearest city in the middle of winter, which is not very lovely. And so I was talking with Ozzy about what a hurdle this was for us, and she was like, "Why didn't you call Compass?" And I was like, "Oh, brilliant." So I called Compass, and within 45 minutes, she, I feel awful. I can't remember her name because she's so amazing. Haja. Okay. But within 45 minutes, she had taken me through everything that I had, could possibly need with CF, had made sure every one of her specialists in Denver would be covered, and our premium went from $1,400 down to $275 a month. So for us, that was huge. And so that aspect of the program was invaluable to us. And I know I've heard just so many amazing success stories with Compass. But the other side of that is really just the outward expression that Compass is. It's that change from just being the research-focused company that it was when I first came into this community. I remember calling and being like, I don't know what to do. We didn't have a care center. I was actually given the diagnosis by the hospitalist, and I didn't have a CF appointment for 3 months. And so I didn't know what to do with that diagnosis, and I called the CFF, and they said, you need to call a local nonprofit. And I remember just being like, I don't know what to do with that. And to just see how far it's come in 9 years is amazing. And this impact of us as people and humans in this, not just patients and numbers within a registry, but that there's the application of what we actually need on a day-to-day, and kind of removing those extra stresses that add up so quickly in our lives. It's amazing how between treatment 1 and 2, it's a whole list of what we need to do, right? I mean, it's just kind of an ongoing every week, and to be able to pass that off and know that those people have the interests and the education and the compassion to really be able to assist us is just very, very comforting. So we're very grateful.
Thanks, Kat. Thanks, Laurie. So we have a few questions coming in, and let's see if I got to jump down to the question slide because I don't remember how to tell you how to get on the questions, and now I've missed it. Oh, it's at the beginning. Sorry. I'm just going to talk here until I find it. Dun, 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 dun. And maybe I won't do a happy dance. Yeah. There it is. Okay. So we are taking questions. We would encourage you, if you have not already, to drop on into the site on your mobile device and select this session, which is on coverage and access issues through policy and Compass, and submit us your what's on your burning on your mind. So we have one that I can knock out pretty quickly. How is Compass funded? Compass is a program of the Cystic Fibrosis Foundation, and as Ozzy said, it's free to anyone who uses it, and we are really proud at the Cystic Fibrosis Foundation to be able to provide that to the community. We know how important these issues are, how challenging they are. We actually just recently completed a survey, very comprehensive survey of the CF community, and the number one thing that people said they're worried about was insurance and financial issues. So we hope this is a place that can help you get started tackling those. Okay, Ozzy, there's definitely some interest in the other bucket, and I agree, prize to anyone who can come up with what that is other than other, but it's other because it's so comprehensive, and I'm always blown away by all the different ways that Compass has found to help people navigating and identifying potential resources. But this one's particularly about scholarships. Is that something that Compass does, and can you talk a little bit about that?
Thanks, Mary. I'd be happy to. So As I mentioned before, we have been collecting information about so many different programs over the years, and one of those buckets of programs is scholarships. There are many, many different programs out there, scholarship programs or education assistance programs. Some are very local to where you live, so and really they have different eligibility criteria. So what I would say is contact us, and we will hear your situation and figure out which program is best to refer you to, and we will help you connect with the program. And some of them do have some deadlines, so we can provide all of that information to you as well.
Okay, here's another one for you, Ozzy. Can Compass help with the transition? In this case, it's onto Medicaid, but I know transitions, and maybe Laurie might want to chime in on this one too. Transitions, whether you're aging off your parents' plan or you have a job change, that's a big point of stress and confusion about what's best for you. Can you talk a little bit about Compass Can Help?
Sure, I'd be happy to. We help people going through transitions with insurance every day, whether it's moving from an employer program to another employer program, whether it's moving from a private plan to Medicaid or Medicare. We can really help with that process. We can help you through the enrollment as much as we are able to, and then when necessary, we do work with a law firm, Suffian and Passamano, who help with the actual Social Security application process, and we help connect you with them. So definitely, I would say if you are going through that transition, contact us. Just this past year, 2016, during the open enrollment period, we helped over 300 people enroll for new insurance plans, be it through the marketplace, Medicaid, employer plan. So we are very, very accustomed to this, and we can certainly help.
Yeah, I would say that I've found Compass really helpful with young adults who are approaching the age 26. And so the case managers have been really good about holding their hand and helping them understand what options they have and walking them through the process because it's new to them, right? The other way I've found Compass helpful is occasionally, and I don't really understand all the rules about this, so I'm the wrong person to ask, but if a young adult has disability, they might be able to stay on their parents' plan past the age of 26. So Compass has helped with that as well. So I would encourage during a transition of any type, but especially with young adults navigating this complicated world of insurance, it's helpful.
And Kat, maybe you can speak a little bit about some of your experience, because obviously you guys were looking at various plans, and sort of walk us through the process and what questions you had going in, and what was the conversation with Hajan like at Compass?
Yeah, and I'm sorry, I totally forgot to explain like how we got the lower premium, but yeah, so we obviously have pretty specific needs, and feeding tube formula and diabetic, medications are just always the most difficult to get covered. And so those are kind of the key ones that we're always trying to work with. But essentially, we talked with the Compass team and really went over every single medication. And then she went through and matched up all the different copay plans. And so essentially we could buy sign up for the program that had the really high deductible, because the copay cards would cover that deductible within the first 2 weeks. So we just had to kind of strategize how to buy the meds that first time so that we'd hit the deductible using copay cards. And then we were able to have the same coverage but have a much lower premium.
Thanks. This question is for Laurie and Ozzy. And Laurie, let me have you tackle it first. Talk about timing, right? Would you recommend going through your clinical social worker at your care center first, or Compass? And maybe you can talk about the collaboration that you think works well that you've seen as a clinical social worker.
Sure, I think that's a good question. I've worked at 2 CF centers, one smaller, one larger, and I think that some of you have different access to your social workers at your centers, correct? Like some of you may see them and know them, and other ones you may not. So I think it depends on your situation, and it might depend on what you're asking about. I think you could call either one, and I don't think Compass is going to get mad if you call first, and I know the social worker's not going to get mad if you call first or second. So whatever is easier for you to do, and I think what's happened with me is if Compass has received a call and they think I can help with this and might have a better answer, they contact me, contact our center, and vice versa. So I think do whatever is easier for you.
Ozzy, you want to weigh in on that?
I couldn't agree more, and I'm going to borrow from what Ginger said earlier today. It takes a village and collaboration. I think, we work so closely with the care teams to make sure that we have everything in place. It is a true collaboration and partnership. So really, when there are situations where we see this overlap, we absolutely work very closely together. So whether you contact, and we often say, by all means, contact your care team. Make sure everything is in place before you contact us, particularly when it has to do with medications and things like that. But you can absolutely call us as well, and we'll work through that with you.
Here's a good one, and maybe for both of you too as well. It's about job change. Any advice in navigating a new job or an insurance transition, which I think we've touched on a little bit, before a job offer? Thoughts?
We've actually had calls like that. This is not unique, I'll tell you. So we have had people call us. Of course, we can't make that decision for you. It is really a very personal decision, but we can certainly, talk through the insurance options that might be given by the new employer. If you happen to know, in one case we did know, and another we didn't. They didn't have that information ahead of time. But as much information as you might have that you can share with us, we can certainly guide you, but we would never make that decision for you.
Here's how I advise adults looking at a new job. This is what I would do for myself. You have every right to ask what the benefits are. If the new employer is having trouble showing you what the benefits are, that's kind of a red flag. I think it's important for any of us, especially in this healthcare climate, to know what the insurance carrier is before you accept a position. I think Compass or your clinical social worker can help in finding out and confirming if that insurance is in network with your current CF center or if you would have to think about changing. So I think it's very important to ask that. It's very important to get answers, and I think most employers have no problem with that. So.
Thank you. Here's one for Ozzy as well. How can I get tested to see which CF mutation I carry?
What a great question. So I don't know if you all are familiar that the CF Foundation has a mutation analysis program that is free genetic testing for people who have either never had their mutations tested or might only know one of their 2 mutations. So there is a genetic testing program available through the CF Foundation. What we would recommend is that you speak with your provider and have them contact us. It is a provider-driven program. So your doctor, your care coordinator, they would need to get the paperwork started. And of course, there is a blood draw involved, so we do suggest speaking with them first, and then that kind of starts the process, and we go from there.
Thank you.
Great question.
Just a great question. Thank you all very much. This is a great panel. I had fun doing this twice with you. Thank you all very much. We had fun doing this once with you all. Thank you all very much online. We appreciate you tuning in. And that wraps up this breakout. And I think all that is left from VLC is the boot, scoot, and boogie. So we'll see you all out there.
Thank you.